I am Dr. Hitesh Garg. I am working as Senior Consultant and Unit Head, Department of Spine Surgery at Artemis Hospital, Gurgaon. I started my journey in spine surgery around 10 years back after I completed my post-graduation from KEM Hospital, Mumbai. So I have accumulated almost 10 years of experience in spine surgery where I am doing exclusive spine surgery. I have a full team consisting of spinal consultants, fellows, residents, and intervention radiologists working with me. In spine, we cover the entire spectrum of spine diseases, right from the occiput till the last bone, that is coccyx or sacrum. We cover spinal trauma, spinal infections, spinal tumors, degenerative diseases of the spine like lumbar disc prolapse, cervical disc prolapse, compression over the spinal nerves, compression over spinal cord known as myelopathies, or spinal instabilities. We also correct spinal deformities like scoliosis, or which is known as a crooked back. The spine is curved, so we correct that, we make it straight, and we have the recent most advanced high-end technologies available for the same. At our hospital, we have neuromonitoring systems, we have OM, we have navigation systems to make the spine surgery very safe. Till now, I have done close to 3,000 spine surgeries, and I can proudly say that our success rate has been close to 98% in these surgeries. As far as the training is concerned, I have trained with the best centers in India like All India Institute of Medical Sciences, King Edward Memorial Hospital, Mumbai, which the two centers which are performing the highest number of spine surgeries in government setup in India. Then I have traveled abroad. I have done 1 year of clinical fellowship in spine surgery at Yale University at Yale New Haven Hospital in Connecticut, USA. I followed it up with another fellowship in pediatric spine where I learned correction of complex spinal deformities at Shriners Hospitals for Children, Philadelphia. Today we are going to talk about one of the very common spinal problems, that is lumbar disc prolapse. Now, what is lumbar disc prolapse? Our spine is made up of these blocks of bones, and in between these blocks of bones there is a cushion which is known as disc. Now, this cushion consists of a jelly in between. Now, whenever we get any shock, these discs protect these bones from that shock. Also, there are nerves inside the spine which control the movements of the legs. Now, whenever we get any sort of shock when we are traveling, these nerves are protected because the entire shock is absorbed by the disc. Also, at the same time, while we are able to sit straight because of our spine, but at the same time they provide flexibility because with the help of disc we can move. So that is why we can bend, we can flex. Now, what happens over a period of time? The disc degenerates. As we get older, the water content of the disc decreases, and at some point of time when the pressure inside the disc is very high, like if we are lifting very heavy weight, or we met with some accident, or there is a sudden jerk, this disc material herniates out. And even if sometimes it does not herniate out, slowly over a period of time disc becomes older, and once the disc gets older, it starts pressing on the nerve like this. A small portion of the disc or the jelly that is inside the disc that comes out and starts pressing on the nerve. Now, these nerves are going into our legs. Once there is pressure over the nerve, it starts causing pain, very severe pain in the leg. Now, what are the common symptoms? How does the patient feel when patient is having a spinal problem in the lower spine or in the lumbar spine? So, couple of things. Patient can have back pain and patient can have pain going down the legs. Now, why does back pain happen? Back pain happens whenever the disc gets bad. Whenever the shock absorbing capacity of the disc decreases, the weight starts falling on the small joint. There are very small joints in the back. So the joints have to take the weight, and then it starts causing the pain in the back. Also, if there is pressure on the nerves, this pain starts going down the legs. So what happens when patient starts getting these symptoms? The first thing that we always tell the patient is that you should try exercises. If we strengthen our muscles, if those muscles are able to support the spine well, then what happens? Less and less weight falls on the disc and the joints, and the patient gets relieved of the back pain. So this is the first step. Now once if they're like 90, I would say 90 to 95% of the patients, they are able to manage their pain with exercises and modification of lifestyle. Like we say, don't lift heavy things. If they lift heavy things, the pressure inside the disc increases. Now if you don't lift heavy things, we will not feel the pain. So if patient can manage with little bit of modification of lifestyle and do a lot of exercise, strengthen the core muscle, most of the time this pain goes away. But there are 5% of the cases where the pain persists despite trying all these measures. Like we tell the patient to try these measures for 6 weeks to 3 months. If the pain persists despite trying all these measures, or because of the pressure over the nerve, patient starts developing pain in the leg. Now how will the patient feel when patient starts developing pain in the leg? The patient can feel pain in the leg when he sits or when he walks. Like he will walk a certain distance, he will feel there is a sharp shooting pain going down the leg, or he will feel his legs are getting numb, or he will feel heaviness in the legs. If he starts getting these symptoms and they do not get relieved after 6 weeks to 3 months of physiotherapy or exercises, then we have to intervene. We have to give a good quality of life. Now if we follow this strict protocol, then we have very good options these days. The success rate of spine surgery has improved remarkably. Now we are doing everything minimally invasive. Now what are the different things that can be done for such patients who do not get relief from conservative measures? So I would say these patients do not have to keep suffering from back pain. They can be relieved of back pain as well as leg pain. Now the first thing we do is, if there is pressure on the nerve, we have to remove the pressure over the nerve. That is the first and foremost thing in spine surgery that is done in each and every kind of spine surgery, that we remove the pressure over the nerves. Now we do very advanced diagnostic studies in patients with MRI scan. We do CT scan and we do dynamic X-ray. Now what is MRI? MRI will tell us about the muscles, about the ligaments, as well as it shows us the nerve, the disc, the bones, everything. CT scan tells us about these joints much more than an MRI tells. And X-rays, nowadays we do dynamic X-rays in standing position when the patient bends forward or bends backward, so we know how is the movement of the spine is happening. Now there is a normal movement of the spine. The spine moves normally synchronously like this. This is normal. But sometimes the movement gets abnormal and the spine starts moving. Let me show you. Spine starts moving like this. So if I take this spine, so instead of the normal movement, this is normal movement of the spine. Spine starts moving like this once the disc gets bad. So these are some of the things which we study with MRI, CT scan and X-rays. Now, if there is no instability, the movement of the spine is normal, and on CT scan these joints are okay, and the patient does not have much back pain. His main problem is pain going down the legs or claudication, that is he feels heaviness in the legs or there is weakness on the legs. Then we recommend that we should just do microscopic decompression. In microscopic decompression, we go with the help of microscope, we make a very small incision, or we go with the help of tubes, and wherever there is pressure over the nerves, like in this, if the pressure on the nerve is from the disc, we will just shave off this part of the disc. So by doing this surgery, we have not caused any further damage to the spine. We have just removed the pressure over the nerves. Patient can do everything. He can flex, he can bend, his movement is normal. The recovery time is very fast. Patient is in the hospital just for 1 day. Patient is discharged on the next day. Patient can join back the duties within a couple of weeks. But he has to be a little careful for 6 weeks. And after that, he can do most of the things. Of course, he has to strengthen his core. He has to keep his core strong so that he does not start getting back pain in the future. Now, there are more advanced options. If the patient has a lot of back pain because of arthritis in these joints, or because the movement of the spine is abnormal, as I had shown you, then we have an option which is known as spinal fusion. Now spinal fusion surgery is basically to stop the movement between these two bones. Now how do we do spinal fusion? Of course we remove the pressure over the nerves. Now with spinal fusion, what we do is we insert these screws into the spine and we connect them with a rod. Once we connect them with a rod, there is no movement in the spine, but that does not ensure that the spine has fused, because over a period of time these screws can fail. So what do? We remove the disc. So this normal disc, we remove it completely and we replace this with a cage. This is a small cage. Now once we replace that with a cage, this cage is filled with bone graft which is taken from the patient itself. Now there are various strategies to put the cage in. Once we put the cage in and we fix it with screws and rods, the success rate of spinal fusion almost becomes 99%. But of course, it has its own problem that it of course stops the movement there. So the patient will feel that the flexibility has decreased little bit, but his back pain is gone completely. So we recommend this surgery only when the patient has significant back pain or there is a lot of instability. The movement is not normal. And amazingly, we did a study where we did study the movements of the patient before surgery and after spinal fusion surgery. The actual movements of the patient after spinal surgery were actually more, because before surgery the patient was not able to move because of a lot of back pain. Though we have done spinal fusion, we are actually decreasing the movement, but after surgery the patient's clinical movement from outside have increased because his pain is gone. So just by doing this surgery where we put the cage, we replace the disc with the cage, the success rate of the surgery becomes almost 99%. This surgery is known as a T-lift surgery, that is transforaminal lumbar interbody fusion. Now this surgery can be done open where we make an incision, or it can be done through tubes also, which is known as minimally invasive spine surgery. The recovery again is very fast. Patient is kept in the hospital for just 2 to 3 days. Patient starts walking on the very next day of surgery, and after that patient can join back the duties in 3 to 4 weeks. But patient has to be careful for 3 months because the internal fusion where these two bones will fuse with each other, it takes 3 months. So we tell the patient to take some precaution like don't sit on the ground, don't bend forward to lift heavy things for around 3 months. After 3 months, most of the fusion has happened and patient is fine. At the end of 9 months, once the fusion is very solid, we tell the patient that he can actually go and actually play football if we have done the fusion at 1 or 2 levels. Now if we have done it at multiple levels, of course it puts restrictions, his movement will be less, and then he cannot do flexibility sort of things like yoga or playing football and cricket. Now a lot of patients, they don't like this fusion because it definitely puts a little bit of decreased flexibility. Though the pain is gone, patient is comfortable, but now there are some patients who want that we don't want fusion. So we have actually even more advanced options where we have come up with newer technology which are known as motion preserving technologies, where even if the movement is abnormal, we can stabilize the movement with the help of, like, this is one of the devices which is known as interspinous device. This device is put away from the nerves. Nerves are here. We are putting spice much away from the nerves, but it decreases the movement little bit, not completely. Like it will decrease the movement maybe by 40 to 50%. But patient's pain is gone, but patient can still do everything. He can bend, he can his flexibility is same. There are other devices, screw based devices also, where we put screws but we do not connect that with a rod, we connect them with a rope like structure, and in that also patient can flex and bend. So these are known as motion preserving surgeries. Of course there are some preconditions that patient's facets, joint should be fine for doing this surgery so that patient does not feel pain after doing the motion preserving surgeries. So as you can see, we follow very strict protocol. What we tell the patient that you should try physiotherapy, you should do a lot of exercise, you should do strengthen your core muscle. If that relieves the pain, then there is no need to go for surgery, and this is possible in 90 to 95% of the cases. In rest 5 to 10% of the cases where the pain does not go away or patient starts developing weakness in the legs, then we have 3 kinds of options. One, that we do only microscopic decompression where we remove the pressure over the nerves. This surgery is done if there is minimal back pain and there is no instability, the movement of the spine is normal. Or we say there is a spinal fusion surgery where we fuse the bones together, we remove the disc and we put a hard spacer known as cage filled with bone graft. This surgery is done if there is arthritis or there is instability, the spine is not moving normally, or if the patient has a lot of back pain. And the third is motion preserving surgery, which is done if the patient has back pain, we still want to fix it, but we do not want to take out the movement completely. We want to preserve some movement at that segment. We have very advanced options which is known as motion preserving surgeries. The recovery time in all of these cases is pretty fast these days. Patient can join back the duties within 2 to 3 weeks. He is kept in the hospital in like microscopic decompression only 1 day, in the fusion or fixation surgeries for 2 to 3 days. Thank you.